Innovative approaches towards HIV epidemic control and program sustainability at state level is Nigeria's newly adopted strategy in achieving the global target of ending AIDS by 2030. You are watching The Last Mile with NACA, and I am Adesuwa Osui. Welcome. Nasawara is one of 5 other states privileged to have a NACA zonal office domiciled in it. This episode highlights the HIV response in the state led by the state's Agency for the Control of AIDS, NACA. Don't go away.
Nasawara State, bordered to the east by Taraba and Plateau states, to the north by Kaduna State, to the south by Kogi and Benue states, and to the west by the Federal Capital Territory, plays host to the North Central Zonal Office of the National Agency for the Control of AIDS, NACA.
The NACA Establishment Act of 2007 made provision for creation of zonal offices. That did not come into being until 2019, specifically for this office. For the North Central Zonal Office, it was commissioned in December 2019. And the North Central Office is located in Lafia, Nasarawa State. But the office actually oversees the 6 states and FCT in the North Central geopolitical zone of the country. Basically, the zonal offices were actually created to represent NACA at the state level. And our major responsibility is to support the state agencies to fulfill their mandate. And the basic activities we do is that of coordination. But most importantly, our job is to make sure that we short-circuit the reporting gap between the states and HQ.
The Nasarawa State Government, through its Agency for the Control of AIDS, NACA, established in 2007, has put several measures in place to prevent new HIV infections and improve the quality of life of those infected and affected in the state.
Over the years, the prevalence of HIV in the state has been decreasing because we went on a massive campaign because first of all, people need to know what HIV is all about. So a lot of education, sensitization, meetings and talks to the community, and also to let them know that HIV is not a death sentence. In fact, we are one of the first states that have anti-stigma law that was enacted and also enforced. That was in 2012. And we try to sensitize the people living with HIV to tell them there is a law backing them. They should not discriminate them anywhere they are, whether in their working place. And we work in collaboration with Ministry of Justice, National Human Rights Commission, and trying to educate even the religious leaders, traditional leaders, so that they will not stigmatize people that are HIV positive. And here in Nasarawa State, we have over 480 sites for HTS, and we have PMTC sites, and we have where people can access their drugs. So we have a lot of sites. You don't even need to go far. You can it may just be a walking distance from your place, in which we are trying to see that we establish more sites.
According to the Nigeria AIDS Indicator and Impact Survey, NAIS, conducted by NACA in 2018 to assess the prevalence of key HIV-related health indicators, Nasarawa State recorded a prevalence of 2% with an estimated 23,306 people living with HIV.
In 2018, when the NAIS study was done, we discovered that our gap was about 22,000. That's out of the 62,000 people that are HIV positive. We can only account for 41,000. So 22,000 were nowhere to be found. So when the search project was launched, and we started looking for those 22,000, I'll tell you by now, we have even more than 80,000 people on medication. So we even supersede this 22,000 that we are looking for, because we got over 40,000. So right now, people that are accessing care, HIV drugs, they are up to 81,000 in the state. And our viral load control is also good. It's about 94.5%. And a lot of them are well suppressed. And the suppression rate is also about 95%.
The location of a zonal office in a particular state is usually of advantage to that state. And that's exactly what Nasawara State is benefiting based on the fact that the zonal office is located here. Proximity, we are just only a phone call away from them in terms of need. And every now and then, we are also privileged to participate in all the activities. And I can tell you for free that the relationship between the zonal office and the Nasawara State Agency is very cordial. The relationship between the agency and the State Ministry of Health is also very cordial. We also relate very well with the Office of the Deputy Governor that oversees NACA. And that has also helped us to even interface with the traditional ruler, that's the traditional institution ably represented by the Emir of Lafia.
Well, for us here, I don't think we have any challenge, because we have the zonal office that is located in Lafia, which is more easier for us to access the NACA people from the zonal coordinator. Then if we have any challenge, we go to the zonal coordinator. From the zonal coordinator, he can take our challenges up to NACA. That's how we operate. But so far, so good. The relationship with the zonal coordinator has been cordial, and he has been of help. He has contributed a lot to our activities here. Anytime we have activity, we invite them to come, and they participate, they advise.
The state's collaboration with traditional birth attendances is helping to curb mother-to-child transmission of HIV, as well as child and maternal deaths.
A lot of women, they don't come to deliver in the hospital. So, but the traditional birth attendants, because they have different opinion about delivering in the hospital. Some people say in the hospital they ask them to lie down, they prefer squatting. So that's why they don't come to the hospital. And sometimes they say that, okay, the hospital environment is not friendly. So they have different reasons for not coming to the hospital. Some people, they say no, they put ruwan nakuda in Hausa, that's pitocin. So it makes the labor more painful. So they would prefer to deliver at home. However, generally, we have encouraged women to give birth in the hospital. There are many jingles that are going on in the media, Nasawara State media, to encourage women to go for antenatal in the hospital and also to deliver in the hospital.
In Nasawara, we are not allowed to conduct delivery. But before we do it, now we are told to refer a patient to either any institution, whether hospital, clinic, or somewhere else. You know, before we conduct delivery, we are not wearing gloves. We don't know what is transmission. After finishing, we have just laid a Macintosh where each woman will come and lie down there. We are not putting, now they told us to be using jig. So before we are not using jig, we use soap and water. You know, and during the training, they have to tell us different aspects. What is HIV? They tell us. And then how can we get HIV from one person to another? They tell us. How can we prevent even ourselves to get HIV? And also to prevent the client that happen to come to us. And that is why now, if you will go to Nasawara, morbidity and mortality rate have reduced because we have knowledge now.
Bordering numerous states, the HIV response in Nasawara State is faced with some peculiar challenges.
Most of people that work in Abuja, they stay in Nasawara State. If they capture them when they are staying in Abuja, they will assume that they are part of Abuja. Meanwhile, they live in Nasawara State. So some of our challenges is under reporting, you understand, and also movement of people from one state to another. Another thing that we notice is the key population. Knowing that the prevalence in the key population is high, is far higher than the normal population, and they are mobile people. They don't stay in one place. Today they are here, tomorrow they are there. But however, we are working in close collaboration with the key population because we have a technical working group dedicated specifically just key population technical working group, in which from time to time we try to mark the hotspots. Are there new ones? Are there old ones that have been closed? So that at least we'll also reach them with the minimal intervention to see how we can cope HIV by 2030.
Also is issue of some few who are deniers, and some of those ones, when you do a quality counseling, you find out that they will accept, because ideally some people, when they find out, they will be in shock, they will be in denial phase and then over time with the quality counseling, using all the skills, you find out the person will be able to accept. Other challenges too is issue of stigma and discrimination. Despite all the efforts, we still have them. People still think that, when you have HIV, you can't wear my clothes, you can't touch what I eat, you can't use the same cup with me and all that, even in the offices. So, but Nasawara State has already done a great job in that aspect, because the anti-stigma law is already signed in the state and it's working.
Funding is a major challenge, also hampering the progress of the state's HIV response.
All the states we have visited, we have noticed that there's paucity of funds. We have noticed that annually we have appropriations made, but no releases, or very little releases made. We've had most state SACAs write memos that never get approved, never get funded. So funding has actually been a challenge. And most of the activities that we see happening in the states were hitherto done by the implementing partners. But you agree with me that there is donor fatigue, the donors are getting tired, their resources have dwindled over time, and there is this palpable fear that by chance the donors move and very soon they will go. There's going to be a huge problem. You got to know that the treatment program is a very expensive program, provision of ARVs. None of the states have taken the bull by the horns to make sure that they provide ARVs for our positive clients in the state. So most of the states have been going through this funding. Nasawara is not an exception. In some of the states, you see that if the donors don't bring out money, there will be no coordination meeting. There will be no SACA IP forum or any coordination meeting happening. But in Nasawara State, I must also give it up to them that yes, they have been doing that, but it is not enough. But of course, we know that the time bomb is ticking, which is by the time we have all the donors exiting, the onus of funding the HIV state response, we have to squarely rest on the shoulders of individual state governments. The earlier we realize that, the better.
The Nasawara State AIDS Control Agency is poised to contributing its quota to the national response in achieving HIV epidemic control by 2030, and the NACA Zonal Office is always ready to support.
Our contribution on the technical working group, particularly that oversight key population interventions, and also making sure that some of the new innovations that normally the state had not been implemented at that time, we also guided them, because you also remember that we are in the state also to bridge the technical gap between the implementing partners, the SACA as an agency, and the foot soldiers on the field. So when you look at the statistics and you look at what the trajectory is now compared to what the 2018 NICE result came out, we are proud to say that yes, the zone has also contributed, more so that we are always available and ready to support them.
Much work has been done in the fight against HIV/AIDS in Nigeria. However, more work needs to be done. Together, we can end AIDS by the year 2030, even amidst coronavirus pandemic.
Educate yourself. This is crucial in the fight against HIV and AIDS.
Get tested. The only way to know for certain your status and stop the spread.
Get involved. People with HIV and AIDS need care and support.
Say no to stigma. Stigma prevents people from getting tested and those living with HIV from treatment.
Spread the word. The more we educate others about the disease, the better we can fight it.
Adhere to COVID-19 prevention protocols, wear a face mask, and maintain physical distance in public places.
Remember, only united can we defeat HIV to finish and end AIDS by the year 2030. Get tested today. Let's fight HIV to finish in Nigeria. What we want people to know is that there is an act against HIV stigma and discrimination. And the act has two components. There is the jail component, there is the fine component of it. So it can be both, actually, depending on the gravity. People with HIV live normal life. They work as productive as any member of the community. And among them are intelligent people, hardworking people. Why should we discriminate against them? If we stigmatize people and we discriminate, it puts them away from our hospitals. It prevents them from coming to our facility to know their status. It prevents them from coming to our facilities to take these medications that are very helpful. So stigma is a number one enemy for us in fighting HIV disease and in controlling HIV disease. And we will be all out against it.
For Nigeria to attain HIV epidemic control and sustain it, there is need for the states to play more active roles in the national response. Update segment is next. Keep watching.
In line with its commitment to attain HIV epidemic control in the state by 2030, the Taraba state government, through the State Agency for the Control of AIDS, NACA, recently commissioned the Taraba State Situation Room, also called the Epidemic Control Center, at the NACA office complex. The Situation Room is powered by the Data for Implementation project funded by the United States Agency for International Development, USAID. In his remark, the Honorable Commissioner of Health, Dr. Innocent Vakai, thanked USAID for the support and pledged the government's commitment towards ensuring sustainability of HIV response in the state. Goodwill messages were delivered by representatives of implementing partners and USAID.
In 2019, there was a need after the NACA study that showed the prevalence of HIV in Nigeria to begin to use data as a means of informing whatever decision will be taken going forward. And at that point, USAID, with the support from the American people, through some of our partners then that were implementing HIV in Akwa Ibom State, that incidentally then was one of the such states that we needed to implement such. So we established a situation for that purpose. So today, it gladdens my heart representing USAID also here to say that USAID has also extended that support to Taraba State. And I believe and I know that the state is going to put this to judicious use to achieve epidemic control in Taraba State.
The Director General of NACA, Dr. Garba Danjuma, while commending USAID, stated that the partnership has strengthened the agency's coordination structures.
With our work over the years, we have reduced the prevalence in Taraba State from 10.5% in 2012 to 2.9% in 2018. We still have some work to do, but I want to tell you that at the last National Council on AIDS meeting, Taraba and Lagos State were selected among the best states in Nigeria. So I want to tell you that with our collective effort here, we're able to raise the bar very high. So it's our own responsibility to maintain that bar, and it's not easy to maintain success. I want to say that with the coming of the USAID project in the state, it has strengthened our coordination structures, especially at the local government level. We have inaugurated the search committee at the state level and at the local government level. Our NACA coordinators are now very active. They are now coordinating the response at the LGA level while we are coordinating at the state level, and that is how it's supposed to be. We want to assure you continue with that momentum and to reduce the prevalence further down.
Speaking further, Dr. Danjuma explained the importance of the Situation Room to HIV response in the state.
This situation room is going to serve as a center where we can see what is happening in the health facilities, in the communities. That's all the data generated from where the USAID are operating is going to be transmitted real time here so that we can identify the local government or facilities that are not doing very well so that we can encourage them to improve. So this is a very good development for Taraba State because we are going to have data that is going to help us to have a kind of evidence-based planning and decision-making for HIV response. So, and also we are going to have the opportunity of publications showcasing to the rest of the world what we are doing by the data that's going to be generated in this situation room. So this is a very good development for Taraba State. Taraba State happens to be the third state now in northeastern Nigeria that is supported by USAID to establish a situation room.
Commissioning of the Situation Room shows the Taraba State government's commitment to 95-95-95 target of UN AIDS, as tracking and compiling data are important elements in understanding and combating the spread of HIV and AIDS.
Sister! Where you dey rush dey go like this now? Take am easy now.
Na hospital I dey go to do HIV test.
Na everything you dey do HIV test. Before you carry belle, you do HIV test. Now you dey rush go do another HIV test. Wetin you dey find, you go see am o.
No be so, my sister. HIV test no be bad thing o. Na make I know my status so that no matter the result, my pikin no go get HIV.
HIV fit pass from mama to pikin?
Yes o. During pregnancy or labour or even when we dey breastfeed the pikin. Yes, and my husband dey road dey come sef, he go meet me for hospital. We go do the test together.
Hey, your husband na man he be. But wait o, una no dey fear. What if the result come out positive?
Fear wetin na? HIV no be death sen ten ce. And medicine don dey to take manage am. See, nowadays people wey get HIV, they live their life normal like everybody else.
You sure say I no go follow you go do my own so?
Wetin you dey wait for now? Come make we go jare. With quick action, we fit stop this HIV waka from mama to pikin. Go do your own HIV test today.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center, toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. Thanks for watching. And as always, continue to support the HIV response. Do not stigmatize or discriminate people living with HIV. Avoid indiscriminate sex. And lastly, know your status and take action. Till next week on The Last Mile with NACA, I am Adesuwa Osuni. Goodbye.